Hi, this is Dr. Afsha Perez, and today I'm going to answer some questions that are commonly asked about whitening, the procedure that whitens your teeth. So, here are some questions, and I hope you get to learn from this video. Okay, the first question is, can anyone get teeth whitening? No, actually, not everyone can get or anyone can get teeth whitening. It depends on the condition of your teeth, the condition of your gums. Then it is decided, your dentist decides if you are a good candidate for teeth whitening or not. Second question is, does teeth whitening damage your teeth? Well, actually, teeth are the enamel, that's the outer layer of the teeth. The outermost layer is the hardest tissue of the body. It's harder than bones, so it's not damaged that easily. No, teeth whitening doesn't really damage the teeth, but it does cause some temporary sensitivity and sore gums, which gradually wears off in a few days. But one thing is for sure, that you shouldn't get teeth whitening done too often. Okay, does it cause sensitivity? Well, yes, it does cause temporary sensitivity. If you're doing it at home, so you should make sure that the percentage of hydrogen peroxide that you use is 1.5% ideally. So commercially what you get is 1.3%, 1.5% or 3% hydrogen peroxide. So to be on the safer side, you should dilute the 3% to 1.5% hydrogen peroxide. That's the half its concentration. Why are my teeth yellow? Yeah, most people and my patients ask me that why are my teeth yellow, and I brush so often but still my teeth are yellow. So the answer to that is can be many reasons that your teeth are yellow. If you brush often, then plaque is not one of the reasons, but if you don't have a very good oral hygiene, then the accumulation of plaque that gives a yellowish tinge to the teeth or calculus formation. If your oral hygiene is well but still you feel your teeth are yellow, then maybe you're brushing the wrong way, you're brushing too hard, you're wearing out your enamel, and you're exposing your dentine. Dentine is the inner layer which is a bit yellow in color, so it gives the yellow tinge to your teeth. So you shouldn't brush very vigorously. You should brush with soft bristles. Take a brush with the soft bristles and give rotational movements rather than going back and forth, which wears out your enamel. The other reasons could be fluorosis, which is a high amount of fluoride in your water, and discoloration by eating habits. Can be due to your eating habits. If you smoke, if you drink a lot of coffee, tea, or sodas, or if you have a lot of ketchup and things which have colorants in them, so that can also stain your teeth. Okay. Other than that, does baking soda whiten teeth? Well, it is a natural ingredient which has been used for many years to whiten the teeth. It has this it gives an abrasive effect which removes the stains of your teeth. So it is a good agent, and the way to use it normally is to take 2 teaspoons of baking soda and mix it with 1 teaspoon of water, make a little paste, and then rub it on your teeth and brush it off. So that removes the stain. So it is a natural teeth whitener, but it's more effective if it is incorporated in a toothpaste. So if you use a soda white toothpaste, so that will give better effects than using just baking soda alone. Okay, how long do the teeth stay white after treatment? Well, normally if you get a professional dental teeth whitening at the clinic, then normally it depends on your habits, your oral hygiene and your eating habits, but it's about the time is about 6 months to 2 years for the procedure, for the whitening effect to stay on your teeth. So then you might need to repeat the procedure. Quickest way to whiten teeth at home. Well, the quickest way to whiten teeth at home, if you don't want to go to the clinic and you want to do it at home, 1 teaspoon of hydrogen peroxide and 2 teaspoons of baking soda. You mix them and it makes a paste that you can put on your teeth, rub on your teeth, and that gives a whitening effect which can last for a few days. But it's better to get it done from the clinic. That's more professional and that's more safe. Okay, how to keep the teeth white after treatment? Well, how to keep teeth white? What you can do is avoid foods, obviously, which have colorants in them, coffees, teas, and sodas, and stuff like ketchup and other stuffs that have colorants. And you can use regular mouthwash, and you can use a whitening toothpaste twice a week, and whitening gels, paste, and certain whitening pens that are available that can be used, whitening drops, twice that can be used twice a week, and avoid smoking. Okay, what is oil pulling? Yeah, it's quite popular now, this term oil pulling, and people ask me what is oil pulling. So actually what it is that you take 1 tablespoon of oil. Any oil can be taken, sesame oil, mustard oil, or any other sunflower oil. That can be taken, and it's just swished in the mouth for 15 to 20 minutes, and then it is spit it out. But the oil of choice is coconut oil, which has good antibacterial properties, so that's commonly used, coconut oil. And the good thing about oil pulling is that it disinfects your entire mouth, so it's good in that way. It doesn't really allow plaque build up, and it removes that, which gives the teeth a yellowing effect. So in return, it does give a little bit of whitening effect as well. Okay, how often can you whiten your teeth? You can whiten your teeth after a year. At least give a gap of a year. If you have done home whitening, then a year. And if you have done it in a clinic, then you can also delay it for 2 years. So at least a year gap is must to have before your next session of teeth whitening. Thank you. I hope you liked the video, and it was informative for you. So if you have any other questions, any more questions, you can always ask me down below in the comment section. And please don't forget to like and subscribe to my channel and my Instagram page. Thank you.